Wake up. It's the Sleep Unplugged podcast with Dr. Chris Winter. This is episode 30, Catathrenia, sleep-related moaning. Here she comes now, singing Moany, Moany. Welcome everyone to episode 30. That seems like a big number. Very excited to be here with you today. If you're new to the podcast, welcome. If you are a veteran of the Sleep Unplugged podcast, welcome back. My name is Chris Winter. I'm a neurologist and sleep specialist in Charlottesville, Virginia. And I'm excited to be here with you today talking about sleep. If you are new to the podcast, you know we do some little housekeeping things at the beginning of the show. There's a few things I want to touch upon before we jump into our topic. 2 episodes back, I believe in the episode on I believe it was the episode on the 9 P's of insomnia. I made a comment about hot coffee, iced coffee, and said, I'll throw it out to the Sleep Unplugged Nation as to what you think about iced coffee. I think it is I don't think that's real coffee. I think that real coffee is meant to be served hot, but I wanted to hear what you thought. And according to Sleep Unplugged Nation, I am wrong and need to rethink my position on coffee. So I said, look, we put some polls out on Instagram and Twitter. So my Instagram and Twitter handles are Dr. Chris Winter if you want to communicate with the show. What do you think about iced coffee? Is it okay or is it sacrilege? 117 of you said it's fine, it's acceptable. Only 21 people out there shared the concern that we were soiling something that's pure and wonderful. So I think I need to change my thinking about iced coffee. I didn't think it was possible to do any kind of poll and have such disparate numbers there. I mean, everything's always, 49% to 51% these days. So the Sleep Unplugged Nation has spoken and said, iced coffee, no problem. The other thing I want to mention, a while back in one of our episodes, I mentioned Celine Dion. I think it was in the narcolepsy episode about unusual conditions. That was episode 26. And I said, narcolepsy is not a rare condition. And we briefly touched upon Celine Dion and her current battle with a condition called stiff person syndrome, used to be called stiff man syndrome. And we decided to add her to the tiny list of people invited to be guests on this show at any point they ever want to be guests. So Celine Dion has a standing invitation to be on Sleep Unplugged. Right after that episode, somewhere in that time, Rolling Stone came out with their top 200 vocalist singers of all time. And despite her 5 Grammy Awards and 4 #1 hits, and let's face it, a voice from heaven, she wasn't on the top 100 list. And I kind of scrolled through there and saw, Glenn Danzig, this kind of heavy metal rocker who, I listened to Danzig when I was in college, but come on, Celine Dion, not in the top 200 singers of all time. So Sleep Unplugged podcast has just put out its list of top singers. And at #1, you guessed it, it's Celine Dion. So we're thinking about you, Celine Dion. I wanted to mention, we always kind of mention at the top of the hour, comments from listeners and viewers. If you watch our Sleep Unplugged YouTube page, you can subscribe to that if you like. Got a lot of feedback from this last episode on snoring, and I thought we would. So far, it's been the most popular episode, most downloads in the first 7 days, shattering records all over the place. So it's going to be very interesting to see what happens this week with more of a niche topic like catathrenia, which we'll get into. But lots of people wrote in and shared their experiences. Jane, I appreciate you talking about your husband and you both using oral appliances to deal with snoring. And I asked Jane a question, how did it go with your insurance? Were you able to get it approved? And she actually was. And so we haven't really gotten into treatments for sleep apnea, which you can put oral appliances in there, but oral appliances can absolutely be used to treat snoring. So I'm glad you brought that up. And she had posted that on my little video I made of funny little things that you could do to help with snoring. Little White Dog Properties, friend of the show, hat purchaser. We really appreciate that. Talked a lot about sleeping in separate bedrooms, kind of that sleep divorce, and that's really been the best decision ever. And I like that not only did you share it, but you shared that. I think it's great that we can sort of demystify the idea that we don't have to sleep in the same bed to have wonderful, loving relationships. So I appreciate you putting out there as well. And Pepper Widget, which is a great name. Appreciate you writing into the show, basically saying, look, um, uh, drinking within a few hours of going to sleep was really a bad idea. And if she doesn't drink, she doesn't snore. And I tend to be in that position as well, too. So really appreciate everybody writing into the show, sharing their opinions and thoughts and criticisms if you have them. Again, my Instagram and Twitter handles are most active on those platforms. Dr. Chris Winter, please interact with us however you like. We love to hear from you. Also wanted to mention another individual. This is a sleep doctor who runs a webpage called Think Sleep. And she wrote the nicest thing. She said, she wrote in and said, I love the podcast. Always thought your humor from your books would translate well on a podcast. So I'm so glad you got it started. This is such a nice, it's great to hear from anybody. It's really nice to hear from peers. And this is Shantha Gowda. She is a Stanford trained sleep specialist. She practices, I think, in North Carolina and California. Again, you can find her at thinksleep.org. And she's just outstanding. Wanted to give her a shout out. And like I said, I appreciate anybody telling me something positive. When a peer of her stature says it, it really, really means a lot. So I appreciate that, Shantha, and appreciate all you do in the sleep space as well, too. Gotta highlight something on Shantha's webpage. This is the Think Sleep.org. I like it when a doctor sort of introduces themselves and says, hey, look, I treat sleep problems, but here's some other things I like. And she has a little thing about more about me. And there's this, very nice picture of her on a yoga mat, looks like outside in a beautiful place. And she talks about liking Pilates and learning about her patients and her colleagues and cooking and travel and cozy fireplaces. She doesn't like the non-cozy variety, but the best is her final which is walks with her son, dog, and husband. I really like that order. I thought that was fantastic. The son, then dog, then husband. And I think we can all relate to that. So all the best to you. Give her a follow if you have a chance. So let's talk about catathrenia, or sleep-related moaning. Before we jump into it, I subtitled the show, Here She Comes Now Singing Moany, Moany. And you might be looking at that and think, oh, you misspelled Moany, Moany. So Moany, M-O-A-N-Y, is actually a real word pertaining to the act or sound making of moaning. And what catathrenia is an individual who makes moaning sounds during the night. Sometimes it's related to it's called groaning, sleep-related groaning. Other times it's moaning. I personally think moaning is a better verb. Groaning tends to be short, guttural, like you groan out in pain. Something hurts you and you kind of make that kind of groaning sound. Whereas if you look up the definition of moan, it's a more prolonged sort of monotone sound, kind of situation. Moaning Myrtle, if you like Harry Potter kind of stuff. Moany Moany was an interesting song. It was recorded by Tommy James and the Shondells in 1968. They had Crimson and Clover that Joan Jett covered. I think We're Alone Now. Remember Tiffany from back in the 80s? She covered that one. And they had Moany Moany. And Tommy James, when he was interviewed, he's still alive. He's living in Ohio somewhere. I think he's in his late 70s. He said, I wanted to record a song and I just needed a catchy name. And I was in New York at the time and saw this big sign for Mutual of New York, which I think is an insurance company, and the letters M-O-N-Y. He was like, oh, that's a great, great word. In fact, he famously said, Had I looked in the opposite direction, the song might have been called the Hotel Taft because that was the sign somewhere else. So I don't remember, 68, I wasn't born yet, the original song, but I certainly remember the Billy Idol song. So he recorded it as a single in 81, but it got really popular when this live version of it was released in 87. And if anybody is of my generation, you remember going to the party when Moany played, and in between the verses, you had to, kind of yell out this sort of X-rated chant, sort of like uh, the Cheap Trick song, live at the Budokan. I'm blanking on it, but I want you to want me. So when he would sing out the chorus, everybody at the Budokan, which was this big, arena, was, kind of screaming in chorus these lines in between. So anyway, love the song, and think it's a great song for our podcast today. So there's your little music trivia. And by the way, Tommy James and Shondells, their song was very popular. Billy Idol released it, and it was number one. It was the number one single for a period of time. And at the end of 1987, when the live version came out, it was one of the top 20 songs. And I was about 15, 16 years old at that point. So, it's that perfect time of your development, your teenage years, and that song came along. So, if you're my age, you probably remember it very well at high school dances and things like that, and yelling in defiance, the little X-rated version, the choruses in between. So catathrenia, interesting word. It comes from the Greek kata, which means below, and threnia, which means lament. So a lament from below, deep within us, we're lamenting because the sound of moaning sounds like a lament. And I'm going to say from the onset here that, hi, my name is Chris Winter, and I'm a catathrenic. So I do have this problem and have had it for years, on and off. In fact, right before I came into my office to record the podcast, I asked my wife and said, hey, how often do I do this? And she said, that's a hard thing to answer because you've always gone through fits of it. You'll have it for a period of time, night after night, and it goes away for a very long period of time that comes back. So this is going to be an interesting episode because unlike the snoring episode that we literally could have talked about for 4 hours and looked at hundreds, if not thousands of research papers about snoring and breathing disturbances, this is a very, very small topic. I was only able to find about 53 articles on a PubMed search. So this is a very, very concise topic here. Originally, it was described in 1983 by Belgian doctor Jeffrey de Roock. You can find his 1983 paper. It's more of a case study. And when we talk about catathrenia, we're talking about a prolonged expiratory moan, meaning that an individual will breathe in, and then upon exhaling, we'll have sort of a long vocalization, kind of thing like that. So it is not sleep talking or somniloquy. Words are not being spoken, nor is it a related version of snoring, which again, our last episode 29, was on snoring. This is not snoring. In fact, this used to be classified as a parasomnia, and we've talked about parasomnias before. In episode 16, we talked about the REM-related parasomnia of sleep paralysis. Nightmares are a REM-related phenomenon. There's some other ones as well too. We haven't discussed REM behavior disorder, where you lose that paralysis we've talked about and act out your dreams. So this used to be classified as a REM-related parasomnia. More current classifications have taken it from the group of parasomnias and put it into nocturnal breathing disturbances like snoring and sleep apnea that we've talked about before. I personally believe it to be a parasomnia related phenomenon. So I don't think that change was particularly helpful, but it doesn't really change the nature of the disorder. So this is a very under-recognized condition. In fact, a lot of individuals are interacting with sleep specialists right now, and not being asked questions about catathrenia. And if you're asking, hey, Chris, do you talk to all your patients about catathrenia? I most certainly do not, even though I have it. So I think I'm probably quite guilty of not having that on my, big checklist when people come in to see me. Hey, do you snore? Do you stop breathing? Ever wet the bed? Do you ever wake up with headaches? Do you grind your teeth, dry mouth when you wake up? Catathrenia should probably be on there. Maybe I'll add it to my list for a few months, and we'll report back in an episode, and I'll try to keep track of, okay, I asked 200 people. Here's how many people of the 200 said they have it. Because if you look at reports, you're probably looking at about 1 in 250 to 1 in 600 people having catathrenia to some degree. To give a little bit of comparison, we talked about maybe 1 in 4 adult men having snoring, 1 in 2,000 people having narcolepsy. So again, narcolepsy episode 26, snoring episode 29. So you can see, this sort of spectrum of disorder from the very common to the very uncommon. It's probably among the more uncommon, but not quite as uncommon maybe as something like narcolepsy. The mechanism is unclear. It's always been talked about in relationship to sexual or the adjective morose types of phenomenon, which again, I would somewhat disagree with. I've talked to plenty of people who have catathrenia, and it's not really related to those types of things. I've noticed in myself when I've been awakened by my wife because of catathrenia, I find that I'm often having sort of a mundane sort of dream, but I am trying to communicate or talk in the dream. So, I'm being questioned about something, or, a doctor says, I always have these dreams that I'm back in medical school or my neurology residency, and we're rounding on a patient. And Fred Wooten, who was my neurology chair at the University of Virginia, says, Chris, what are the 7 most common types of small fiber neuropathy? And I'm panicked and want to get the answer right and not embarrass myself in front of all the younger residents and medical students. And so we always call that pimping, when you got asked questions when you were a trainee and, in medicine, you get pimped on, oh, what are the most common causes of left lower flank pain if you're a surgeon maybe, or something. So I'm trying to answer the question and struggling, and then my wife wakes me up. So there is sometimes an element of stress related to it, but the whole sexual morose thing, I don't necessarily see that a lot in the patients that I'm talking to, and I don't think there's much of a reason for them to lie. So the mechanism of what's causing this is to some degree unclear, but I do want to differentiate that sound that you make. And we've talked about sounds. We did an earlier episode at the beginning of the podcast on white noise. I tried to play sounds of white noise and even make them with my voice, and my recording equipment filters it all out. So I'm not sure exactly what it's going to do with a moaning sound. But the moaning sound is definitely a laryngeal sound. It's coming from the larynx. It's coming from the vocal cords. It's a kind of sound versus a guttural sound, a sound where the throat is vibrating. This is coming from the vocal cords. So I think that moaning, and we kind of associate moaning with sex. That's probably how that sort of relationship sort of came to be, that you're sleeping next to somebody and all of a sudden you hear them going, you might sort of draw conclusions there where there really shouldn't be drawn. So this is sort of the etiology of the sound. And like I said, the sound can be 2 seconds up to what's reported in the literature, 49 seconds, a very, very long sound. It usually gets discovered by a bed partner, obviously. Bed partner says, you were making really weird sounds last night. And a lot of times the patient has no idea they're doing that. Now, sometimes if you were awakened during the sound, you might notice yourself doing it. Other times, if you actually, as you're making the sound, you can sometimes hear yourself. And I feel like sometimes I'm on the cusp of recognizing that I'm doing it, but it's usually happening when my wife sort of gives me a poke and says, Chris. And as I wake up, I realize I'm not trying to answer the question of my neurology department chair, but rather that I'm in bed. So I do often feel that relationship between the sound I'm making, being awakened, making that sound, and being in the state of having a dream. which again should not be a big surprise because we're talking about this as a REM-related phenomenon. I did find one case report where an individual was discovered having catathrenia, was presenting as headaches in the morning, which I thought was kind of interesting. So it probably has no sexual preference, meaning men and women, whatever your gender identity, it's probably likely to affect you just as much as anyone else. There have been studies showing a slight predominance of female over male. However, I've never seen any study that's shown that to be any sort of statistically significant number. And these REM-related phenomenon can be associated with other REM-related parasomnias, sleep paralysis, hypnagogic hypnopompic hallucinations. Again, we're sort of bordering that when you're saying you wake up, you kind of heard yourself, moaning, and you were talking to your boss or whatever in your dream. So that's a very blurred line. I did see also one other thing. I think that there's another REM-related phenomenon, nocturnal painful erections. Obviously, men get erections sometimes during REM sleep. So it's not surprising that if you were getting a painful erection during REM sleep, there could be some nocturnal moaning associated with that. But again, just sort of, it could be sort of true and unrelated. So what are some associated conditions? So if you have parasomnia, if you have catathrenia, what else you're likely to have? It's probably important to state right off the top, this isn't really related to any significant health concerns or morbidity. A lot of patients who describe it feel nervous about that, but that's really not a huge concern. The biggest concern that most patients have is what's going on with their partner. Are you disturbing their partner? So we're sort of hearkening back to episode 29 and snoring about what are we doing in terms of related to our partner. It can be associated with unrefreshing sleep, fatigue, poor concentration, memory problems, insomnia, breathing issues, and sudden awakening. If the sound is loud enough, and the sound intensity can vary dramatically from person to person, it could absolutely wake you up. There was an interesting one study that was done in 2017 actually showed a pretty high relationship between individuals who swim and individuals who have catathrenia. I've got a swimmer in my family. One of my sons was a pretty big swimmer and even swam for a period of time in college. And I need to ask him about this question. I've never heard him do it before, but some people think it might be related to the fact that they're used to holding their breath. And so they're actually kind of doing that at night. And I've had patients say that I feel like I wake up holding my breath voluntarily. Weightlifters may be there too. When they're kind of straining to lift the weight, they're not breathing, they're kind of holding their breath. So perhaps that kind of bleeds over and creates an extra risk for catathrenia. I think stress is a huge risk factor for it, and potentially even something like lucid dreaming. And there were some case reports of individuals taking sodium oxybate, which is a treatment for narcolepsy. We haven't done our narcolepsy treatment episode, even though we did our narcolepsy overview in episode 26, but we'll talk about that too. That is exceptionally a niche group. So the big thing is, what do you do about it? I mean, there's chat groups all over the place about catathrenia because we as doctors let catathrenics down. We don't ask questions about catathrenia, and we provide no great answers for catathrenia. So the best we can do is this. Number one, good, consistent quality sleep that's high in consistency. You're getting the right amount every night can be very helpful. Number two, we want to make sure that individuals are not having breathing disturbances, snoring, sleep apnea, anything related to breathing might be a precipitant of catathrenia. There are some studies that show using a CPAP or treatment for sleep apnea, like the mandibular advancement that one of the Jean, I think, I'm sorry, I'm blanking on her name, who wrote into the show about Jane talked about getting the little oral appliance for snoring. Those types of appliances that we talked about in our snoring episode, there was this Chinese study, I think from 2021, that said they may be helpful in terms of treating catathrenia. I think avoiding caffeine at night, avoiding alcohol at night, those two things are really important and seem to exacerbate my own catathrenia, again, with the stress. And there was actually studies showing that using a CPAP at its lower pressure setting can be helpful. Benzodiazepines, antiepileptic medications, antidepressants. There's some limited case studies out there. They're not particularly impressive in terms of the results. Cognitive therapy, It's been shown to be somewhat helpful in a population of individuals, even things like yoga, meditation. I think all these things are really designed to kind of lower stress. Strength, conditioning, bodybuilding, weightlifting, probably not the greatest thing, just because once again, we're facilitating that sort of holding our breath as we're using, pushing the dumbbells or lifting the barbell or whatnot. So probably not, that's not the exercise you'd want to gravitate towards if you were trying to eliminate the catathrenia. So that's it. I really wanted this to be a relatively short episode and try to keep the lengths of these episodes to some degree varied. Nobody has almost 40 minutes to devote to a Sleep Unplugged episode every week. But I do want you to think about catathrenia, because my guess is people who have it. Maybe you have it yourself. It's a real thing. We do struggle with it in terms of treatment and understanding what it is. But maybe this episode could give you a few ideas of some things to try to get it under better control. And I think going to a sleep specialist with the complaint of, hey, I've got this nocturnal moaning. I've had it for a long time. I didn't know what it was until I heard this podcast. What do you have for me in terms of treatment options? I can almost guarantee you there's a sleep doctor out there. She's smarter than I am. She's got all kinds of good ideas for you that might maybe you can find some solutions there too. So please get in contact with the show. Dr. Chris Winter TikTok, Dr. Chris Winter Instagram, Dr. Chris Winter Twitter. Love to hear from you guys. I have 2 books: The Sleep Solution, Why Your Sleep's Broken and How to Fix It, as well as The Rested Child, Why Your Tired, Wired, or Irritable Child May Have a Sleep Disorder and How to Help. What else? Oh, still have a couple hats left over if people are interested. We gave out trucker hats for episode 27, our Sleep Unplugged awards. So if you're interested in repping the show, just DM me and we can get that set up. Finally, just another huge thank you. This past week, after the snoring episode, we hit broadcast numbers that frankly, we've never seen before, and I can't believe that we are hitting. We have been in existence for about 6 months now. And if you follow the show and some of my social media, you'll see that across the world in different markets, in Thailand and Yemen and Bulgaria, we're one of the top ranked medical podcasts. It's insane. And it's all because of you guys making this show fun, interacting with the show, putting up with Moany and stuff like that, but hopefully feeling like you're getting some good value here. So really appreciate the listen, appreciate the follow, any subscriptions. If you have a chance to leave a rating for the show or a review, it's very appreciated. And that's it. So until next week's episode of Sleep Unplugged, this is Dr. Chris Winter. Sleep well.